September is the month to draw attention to an issue that impacts those of all ages, suicide. However, many are struggling to find the long-term care they need after many shortages are impacting the healthcare industry. Our sister station's Carolina Hassett spoke to several doctors on why they are still struggling with a shortage and if they are worried it is going to impact suicide trends.
The whole mental health system suffers, and the whole healthcare suffers when you don't have access to psychiatrists.
Many doctors have been feeling the impact of not having enough mental health professionals, which has been declining since before the pandemic.
Other professionals are left trying to manage psychiatric conditions, and they just don't have the training or expertise.
Many say this is due to more psychiatrists retiring each year and less entering the profession, along with the number of those being diagnosed with mental health disorders increasing.
My colleagues tell me that they typically have waiting lists of 6 months and longer. Crises in mental health, they don't wait 6 months.
And finding help is even worse in rural areas.
Springfield can be kind of considered a rural mental health area. That could be a partial issue of why we're not attracting enough mental health professionals.
And while hotlines are helpful for emergency care, it's the ability to provide enough long-term care that is missing. One of the primary solutions at the moment is leaving doctors to turn towards others in the industry.
We are actively working to train primary care doctors to better understand and be able to diagnose and treat mental illness.
In the meantime, doctors are concerned about how this will impact suicide and mental health trends.
Of course I worry about that. With lack of mental health supports, you're going to have people slipping through cracks. Invariably, the rates of depression and suicide are going to increase.
And that was Carolina Hassett reporting. According to the most recent CDC data, in 2022, Illinois had an average of 11 per 100,000 dying by suicide compared to the national average of 14.